The spread of metastatic melanoma to the groin lymph nodes is a common event that affects many melanoma patients each year. Around the world, surgeons have different opinions about the best treatment and follow different guidelines for performing the surgical removal of melanoma that has spread to the groin lymph nodes. Some doctors offer patients a surgery called inguinal lymphadenectomy, that is, the removal of the easily accessible groin lymph nodes. Other doctors offer a more extensive surgery called Ilio-inguinal Lymphadenectomy, which is the same surgery but with the additional removal of the deeper pelvic lymph nodes. Both treatments are considered to be the standard of care by different surgeons. There is currently no good evidence about which of the two treatments is better. ANZMTG is currently conducting a clinical trial which compares these two surgical treatments called EAGLE-FM. Firstly, to determine which surgery is better at controlling the spread of melanoma. Secondly, to see if either has any benefit for prolonging life, and furthermore, to clarify which operation causes fewer side effects and results in a better quality of life for patients. As a trial participant, you would have access to intensive care and a thorough 10-year follow-up period, without incurring any additional cost to what is standard, all the while helping to build evidence for strong new guidelines to establish a new and improved standard of care for future patients with melanoma that has spread to the groin lymph nodes.
So this trial is being run by ANZMTG. We are Australia's only collaborative group specialising in clinical trials designed by investigators and doctors for patients who have been diagnosed with melanoma. All of our clinical trials have an independent ethics committee supervising the protocols to ensure the rights and well-being of patients.
The EAGLE-FM trial is a large collaboration involving many hospitals and is open at the main melanoma units across Australia, as well as an increasing number of hospitals in Europe, South America and around the world. The trial is led and conceived by Professor Andrew Spillane, based at Melanoma Institute Australia.
We're very excited to be working with the Australian New Zealand Melanoma Trials Group on this very important study called the EAGLE-FM trial. With the assistance of the Melanoma Trials Group, we've been able to organise this study in many countries around the world now, and we hope that the results will bring benefit to many patients in the future. One of the huge benefits of any clinical trial, including this, is that patients are followed up very carefully and we detect any changes with progression very early and manage them early and give the patient the best opportunity. So altogether, we're very excited about this trial.
The great thing about a clinical trial is that you remain in control of your participation. At any time, participants can choose to have another alternative treatment or go on another clinical trial. Participants can withdraw from this clinical trial at any time if it isn't fitting into their life for any particular reason.
Part of the study is the randomisation to surgery, where we know melanoma surgeons all around the world agree that surgery is the right way to treat this disease, but there is doubt about which way to go, either the inguinal lymph node dissection or the ilio-inguinal lymph node dissection, and which one is what the question is with this trial. And so all patients get the standard therapy, and we're trying to sort out what is the best and creates the least damage for our patients in the future.
Okay, so my name's Cameron. I had the full ilio-inguinal lymphadenectomy, so that's the full procedure, all the lymph nodes out of both the pelvic area and the groin, in November of 2015. Having that sort of surgery was I guess, for me quite overwhelming, because I've never had surgery of any kind before. So going into it, I guess I was a little apprehensive, as you would expect. But coming out the other side, everything, all my expectations that were provided to me beforehand were essentially met. So I did stay in hospital for around 7 or 8 days, which is what I expected. It was difficult to walk around initially, and bedbound for quite some time. But I also, it's fortuitous, but happened to be over the Christmas period when I had the surgery, so I didn't actually have anything on at work and no other sort of conflicting requirements. So I had some good support at home, so the recovery was quite well. It went quite well.
My name is Claire. The surgery I had was a simple groin dissection. Yeah, well, I had the week in hospital because of the blocked drain. I had to go back for a second surgery, and then it was another 5 months for it to heal up. Coming back, I'm still coming back now. So it is a good thing. You get your leg measured and checking out, make sure you don't get lymphedema.
Like all controlled trials, EAGLE-FM is randomised. This ensures the greatest scientific accuracy. It's like flipping a coin, and means that neither you or the doctor get to choose which of the two treatments you'll receive. Before you decide to enrol, your doctor will be able to discuss the details of the treatments, including any possible side effects. This trial can be an appealing option for people who've had a melanoma diagnosis in the groin lymph nodes, and who are also interested in getting attentive care and long-term thorough follow-up at no additional cost. If that's you and you're interested, then speak to your doctor to ask about enrolling in the EAGLE-FM trial today.